We're very pleased to welcome the Reverend Dr. Scott Morris. Scott is a Methodist pastor and a medical doctor. He attended this school, this very school, for a Master of Divinity school, that Master of Divinity degree, and was ordained in the United Methodist Church. And then he went to the medical school of Emory University in Atlanta, and then began a practice in medicine. We were talking as a class, and he described kind of looking for where a large population of poor people were who needed medical care. And he came upon Memphis, Tennessee, and moved there, began a practice with one doctor, that would be you, and one nurse. It is now a remarkable healthcare ministry that is very large, serves 70,000 patients a year. I've talked with people from Memphis, and it's well known throughout the entire community, and no doubt the state of Tennessee. So we've been exploring and hearing about that program, about that ministry, and that'll be a good bit of our conversation this evening. But we're also going to talk about healthcare in America, which is in the news apparently. It's,
really? Are you serious?
It is being talked about.
Did y'all notice that in healthcare?
Scott, we're so glad that you're here.
Yeah.
Welcome back to Yale Divinity School.
Thank you, Bill. This is, other than the time being married to my wife, who's right here, being at YDS was transformative in my life, and so coming back here is a great honor for me. So some of you might just wonder, so why do I do what I do if what we do in Memphis is take care of poor people who have nowhere else to turn? We do this without relying on government support. We do this in the name of the church, but there's actually benefits to what I do that you might not have immediately comprehended. So, anybody ever been to Memphis before? You don't count. Many, that's great. Yeah. So Memphis is on the banks of the Mississippi, and years ago, really before the renaissance of downtown Memphis, if you haven't been to Memphis lately, our downtown's on fire, and it's incredibly cool. But I was actually living downtown, and one night I just couldn't sleep, and I get up and I went for a walk down by the river, and it was beautiful. The moon was full, and you could see the reflection in the river. I mean, at Memphis, the Mississippi River is more than a mile wide. Is it incredibly cool? And I was sitting there and admiring it, and then I felt somebody walking toward me. You know that feeling? They're coming toward me. The closer they get, my heart starts to pound. I'm reaching for my wallet. I'm praying, please, dear God, don't let him kill me. He gets right up next to me. And I swear to you, I am not exaggerating. He was at least 10 feet tall. And he looks down at me and he says to me, "Ain't you my doctor?" At which point I look up to him and I go, "Yes, Jesus, I am." So there are benefits to the type of work I do that you might not have imagined. So at that point he goes, "You know, Doc, you shouldn't be out here by yourself." And I go, "You're right." And so he walks me back to my apartment, and we start talking, and it turns out his name is Nimrod. That's a great biblical name, right? And what I come to learn about Nimrod is that he's a binge drinker, and so he's not always on the street. He was just during one of those times, and so over the next few years, Nimrod and I sort of look out for each other. We have something very much in common as he starts to have joint problems, and I'm now totally bionic. I've got 2 hips and 2 knees, which is pretty impressive. But one of the things we're able to do for people like Nimrod who are uninsured, he sort of works out of the labor pool. He needed a new hip. By God, we could get him a new hip. To do that for poor people, it's not so easy. We got the doctor would volunteer their time. We currently have 1,000 doctors who volunteer their time, not made up number, real number. But then the hospital has to donate their time, anesthesia, We could get all the medical piece covered, but then there's still a big problem, right? That little piece of metal. If I can't get Smith & Nephew to give us that, he's going to get a $10,000 bill. But we got that covered too. So he gets a new hip, and he actually decides to go and take care of his great aunt, and he moves in with her, and he gets off the street. He starts to work. And it's a great story at multiple levels. But for reasons that I have never understood, when it comes to be near Thanksgiving, people give us turkeys. I'm in the healthcare business. I'm not in the giving out turkey business. But so people give us turkeys, and it's all well and good. But this one year, we got one turkey left. And it is Thanksgiving Eve, and I don't know what to do with one turkey. And it's about this time of night. It's pouring down rain, and I'm thinking, what am I going to do? And I think, Nimrod. I'm going to take this turkey to Nimrod. So I put the turkey in my car. I look up Nimrod's address, and this is like really before GPS, and I'm headed to South Memphis. I turn right, I turn left, I turn right. Houses are getting really small. We're all having what are called shotgun houses. Y'all know what a shotgun house is? You know, it's one room, because a shotgun can go through the whole room and whole house and get everybody. It's not a good thing. It's very clear to me, I'm now in a place where I don't need my white face at night, but I screw up my courage. I find the address, and I get out and I go knock on the door. This elderly woman opens the door and says to me, "Honey, what are you doing out there? You just got to get inside because you're getting soaking wet." She doesn't know me from Adam. Now, I do think it made a difference that I had a turkey under my arm. But she calls me in, and I tell her who I am, and then she calls to the back of the house. "Nim, your doctor's here." So then I see this figure coming from the back of the room. There's only one light in the entire house. As he walks toward me, I can't see him. It's just a figure outlined. But it wasn't like that night on the river. I mean, I now know it's my friend, Nimrod. He comes up, he takes the turkey, and then his aunt says, "Honey, why don't you sit down a while and let's talk a spell?" I go, okay, but I'm thinking, we got nothing to talk about. We got nothing in common, so what am I going to do? Thank God she did all the talking. You know, after about 10 or 15 minutes, I say, I got to go. I didn't really have to go. But I get up, and I go to the door, and it's still pouring down rain. And Nimrod goes, "Hey, Doc, hold on for a second. I'll be right back." He goes to the back of the house, and he comes out with a sheet of plastic. And he walks me to my car, holding the plastic over my head while he's getting soaking wet. And I get in my car, and I drive home. And that's how things have changed. You know, I go from being afraid of somebody to our view of what healthcare is all about is how are we in this together in partnership with our patients. And, you know, I can tell that story over and over again. We're just the Doritos factory. You know, we just do one after one after one. So the point of all this is, you know, I am a one-note guy. You know, what is the church's role in healthcare? You want to follow Jesus? It's pretty clear to me in the New Testament. You're expected to do three things: to preach, to teach, and to heal. Now, in our churches, we got the preach and the teach down. But whatever happened to that healing ministry stuff? I mean, our churches don't seem to understand that at all. We We pray for people on Sunday morning. The pastor's expected to visit people in the hospital. A few people visit the shut-ins, and that has defined our healing ministry. All over the country, we have built large hospitals that have church names on them. That they do good work, but they don't have anything to do with worshiping congregations. But if you read the New Testament, it's pretty clear that that healing part is actually pretty important. I mean, from my point of view, if you want to follow Jesus, you got to be in a healing ministry. You personally, as well as your congregation. I mean, do you really want to get to the end of time, look God in the face, and have God say to you, do you think I was kidding about that part? Why did you not do that? But we have somehow felt it was okay to set it aside. All of this is relevant because there is total craziness going on in our healthcare system now. And we in the church have, for some reason, said this is either too complicated for us or it's not what we do. It's more difficult than having a soup kitchen, and so we can't do it. And it's partly because of how we have defined what health is. Being healthy is not about the absence of disease. Being healthy is about helping people live the life well lived. We think that means ultimately helping people achieve what we consider to be the goals for living. I mean, really, at the end of the day, who cares if you live 2 years longer, if it means 2 years longer in a nursing home? Life for life's sake makes no sense. Breathing in, breathing out, I'm not signing up for that. I don't think you are either. So what we ought to be about doing is having more joy in people's life, having more love in their life, and helping them get closer to God. If those things aren't happening, then really, what's the point? So our healthcare system should be about those things. It's not just giving people more drugs. It's not just helping people live longer. It has to be about more joy, more love, and being driven closer to God for it to have any point. But more joy, more love, being driven closer to God, that doesn't have a whole lot to do with the doctor, does it? Now, there is a role for the doctor to this, but there is a huge role for people of faith. And speaking as a Christian, this is an opportunity for us to actually engage in health ministry. Because if you care about your church, and not only have we noticed there's healthcare issues in America, but there's a crisis in the church, right? Our churches are dying right and left. But what if we thought of healthcare as an evangelical tool? You do not grow our churches with more bad Christian rock music. That's not going to grow the church. But if we actually engaged in what the gospel calls us to do, to actually recognize God gave us this body for a reason, and we have an obligation to take care of it, and we help people do it. And in doing it, we're achieving these goals for living. People might actually come to our churches, because we're doing what the gospel is expecting us to do. So that is what drives all the work we do in Memphis. I think it also could speak to this crazy healthcare crisis we have in America. Let me just address that by saying there is no such thing as Obamacare, especially from where I come from. What the Affordable Care Act potentially did for poor people is made it possible for poor people to acquire health insurance in one of two ways. 19 states chose not to expand Medicaid. So every state around me and every state in the South falls in that category. So this is not exactly the case for you, but it will be if repeal and replace ever actually happens. And I don't think they're giving up on that stuff yet, y'all. So the two ways that poor people could now acquire health insurance is, number one, through your state's expanding Medicaid. Connecticut did, Tennessee, Mississippi, everything around us did not. So for our patients, That option is off the table. Okay, well that leaves the exchange, right? Healthcare.gov, you go to healthcare.gov, you put in your healthcare information, and then you get a subsidy from the federal government taking off your taxes in order to buy health insurance. Well, what exactly do you get when you get health insurance off of healthcare.gov? Well, what most people get is the silver plan, which right now, this year, is going to go up by 41% in terms of the cost. But what you get is a policy with a $5,000 deductible. If you work making a minimum wage, you ain't got $5,000. So how is that supposed to happen? But there's a little small glitch in this that most people just are not aware of, which is if your income is below, not above, below 138% of the poverty level. Well, what's that? So roughly $12 an hour. So which is more than 90% of our patients. We care for over 70,000 people. 90% of them, their income is below 138% of the poverty level. So if that's your income and you go to healthcare.gov, you put your information in, you know what it'll tell you? You should apply for Medicaid in your state. Right. Well, wait a minute. I just told you Tennessee didn't expand Medicaid. Now at this point, you either ate too many pigs in a blanket over there, or you think I fell asleep, or you're not paying attention, or I just totally got this wrong. But because what I just told you is the poorest people get nothing. Nothing. You know, if you ask me what the impact of the Affordable Care Act has been on our patients, I'm going to tell you nothing. If you want to know what the impact of repeal and replace would be on our patients, the answer would be nothing. Jesus said, the poor will always be with you. And so far, he has been right. Now, in 2,500 pages of the Affordable Care Act, something that you may not think much about, the words adult dentistry do not appear. It is not in there. We consider dentistry to be an economic issue. You cannot go from a $7 an hour job to a $12 an hour job if your teeth are all messed up. It is not going to happen. So fixing people's teeth puts a smile back on their face, it improves their sense of self, and it helps them get a better job. I got a guy, when I first saw him, he was actually working for one of our volunteer doctors. I mentioned we have 1,000 doctors who volunteer with us, and he has a dental problem. He goes to the dentist. He can't afford the dentist. So he took measures into his own hands and he super glued his teeth together. What he didn't understand is that super glue will eat away all the enamel in your mouth. Don't try that. So by the time I saw him, his mouth was a total disaster. This is America. When did it get to be that I'm working, I'm taking care of my family, I'm doing the best I can, I have dental pain, one of the worst pains you could possibly have, and your only option is to super glue your mouth? I consider that to be immoral.
So Scott, where have you seen the church respond in meaningful ways in the midst of this crisis?
Yeah, so this is really our message. Now, we provide the care, but we also try to be that voice calling the church to task, asking the church to say, what is a healing ministry for your congregation? You know, and if you're a pastor or you're a lay person, we all are charged with that call to discipleship. So over 30 years of doing this, I mean, I can give you one success story after the other where churches would say, oh yeah, that's what we're supposed to be doing.
Tell me a little bit about what that looks like.
Yeah, so just in Memphis, one of the most successful programs we have, we call Congregational Health Promoters. We work primarily with small African-American churches. We go to these churches and identify women, always women, who are giving out healthcare advice. That's how it works in the small black church in the South. The problem is the advice they give is sometimes good, sometimes not so good. We bring these women together and we offer an 8-week training course where we teach them about high blood pressure, diabetes, the importance of prenatal care, they'll go back to their congregation to create a health ministry in their congregation. Not the way we want it done, the way they want it done. And then we provide the support with that. Mm-hmm. So we've done that with over 1,000 congregations. Mm-hmm. I mean, that's an example. Mm-hmm. But look, every church has to do this. We publish a magazine called Church Health Reader, which I don't know if we have any available, but we don't care about the magazine. We are the only magazine ever that started online and went to paper, because we figured out that church people like the whole stuff. Yes. But the only reason we did this is really to drive you to the web. So our URL is chreader.org, and everything we've ever published is on there. It's a very deep site. And literally, there are thousands of stories of churches all over the country, all over the world, who created a health ministry, anywhere from beekeeping to things around parish nursing. Mm. Yeah.
How about advocacy? Is there a place for advocacy?
Yes, there's absolutely a place for advocacy. It's just not us. Uh-huh. And the reason we don't advocate is that it is incredibly hard to provide services for poor people and advocate for poor people. In order for us to have a very wide net, I can't piss people off. Mm-hmm. As Mary could tell you, I'm actually pretty good at pissing people off, but I have to limit that. I have to limit that. The more you advocate, the smaller your influence is. And so what we're always looking for are advocate partners. The person who doesn't mind going out there,
and taking some of the heat.
Yeah, look, right now, the issue for me that I will lay down the street over is our immigrants. 50% of our new patients all speak Spanish. Mm-hmm. I have a young guy right now. This is an unbelievable story for me. Maybe I'll have these same stories, but he's 24 years old, works as a medical assistant for us. When he was 4 years old, his parents crossed the desert at night for the sole purpose of having a better opportunity for their child. Mm-hmm. They find their way to Memphis, of all places. His mother has worked as a housekeeper for 20 years. His father's done odd jobs. He went to public school. He speaks with a southern accent. He has no memories of Mexico. Mm-hmm. So he is one of my best employees. And about a month ago, I am told, he comes to me and goes, so 2 weeks from now is my last day. I go, oh, Josue, that's terrible. I hate that you're leaving. Or where are you going? He goes, well, my visa's run out. I go, what do you mean your visa's run out? He goes, yeah, I'm DACA, and my visa's only good for 2 years, and next Friday, my visa's run out, and y'all can't employ me anymore. Hmm. So I go ballistic. I go to my HR people and go, we're hiring Jose. He goes, you're going to risk everything there is at the Church Health Center if we keep employing him. So 2 days before his last day, he comes to me crying. And I go, oh, Josue, I understand. I feel it's terrible. I wish I could do something about it. I don't know what it'll be. You'll have his job. He goes, I'm not crying about myself. I'm crying because last night, my mother came to me and said, your dad and I can't take it anymore. We're going to go back to Mexico. And we know you'll be okay. You'll figure it out. And he's crying because he's going to lose his family. Mm. It wasn't just about him. Mm. So I've been an American citizen my entire life. I think one of the things that we think we know about being an American is the difference between right and wrong. This is wrong. There's no way around it. This is wrong. Right.
Yeah. We want to hear your questions. And what do you want to explore as you hear the story of this health ministry and the broader questions of healthcare in the United States? Oh, I think we have a mic we want you to use because we're streaming.
Jean Fritz, so what is the role of the church in the current healthcare debate? I've seen churches go to the right or to the left. Is there any way to find like a middle ground and say, okay, those are like the set of values you want to see in all healthcare, no healthcare laws, whatever it is, regulations? So what do you think about that?
Right, so my first thought is the church has to recognize that they have a role to play. You know, what I've unfortunately said too many times already is that, you know, I blame Descartes, who convinced us that we can take a human being and separate us into a body and a spirit. And we have put the body on one side and said it's the purview of science and medicine. We have put the spirit on the other and said it's okay for the church to mess around with our spirits, but it should never cross this line and care about our bodies. So our churches have lived in this world of our only concern is the spirit, and have forgotten that we are fundamentally body and spirit. That is a false dichotomy to separate us, and we don't want to deal with that. And then as we know within our pews, there are people on both sides. So we don't know how to advocate. So fine, let's find a way that we actually create health ministries in our congregation, because I can't solve the problems in Washington. I mean, it's above my pay grade. But what it is possible for us to do is recognize that this is who we are called to be. I mean, when was the last time you ever heard a sermon on dental care? Have you preached that sermon? No, has anybody ever? Nobody's ever heard a sermon on dentistry, because we would say that has nothing to do with who we are as Christians, except for I would argue that it has everything to do with who we are as Christians. You know, that actually makes a difference in people's lives.
Marta.
Hi, Marta Ueck. I used to be a pediatrician, and I'm wondering if you have any community outreach programs for infant immunizations, and also if you partner with parishes or anybody doing pastoral work when you're out if you're out in the community.
Yes, so you're a pediatrician?
Yes.
Did you say you used to be a pediatrician?
Yeah, now I'm a divinity student.
Now she's an Episcopal priest and nearly.
There's no such thing as used to be a pediatrician. So you're really going to like what I'm going to tell you. I mean, yes, we have many, many things that do that. But so we have for almost 20 years now run a preschool, and we're now growing it into a full-blown elementary school under our umbrella. The name of the school is Perea. It comes from when Jesus said, "Let the little children come unto me." That's where he was, in Perea, the west bank of the Jordan River. So we currently have 172 3- and 4-year-olds, and we are growing this into a full-blown elementary school in the poorest neighborhood in Memphis, which you could argue is the poorest neighborhood in America. Now, we also have a family medicine residency, training young doctors in the church health way. And as we grow into the elementary school, the way this is going to work is you want to go to Perea? Great. We're going to be your doctor. We're going to be your children's doctor. We're going to be your family's doctor. We're going to try to keep mom from getting pregnant, but if she does get pregnant, then we will do the prenatal care, we'll deliver the baby, and we will care for that child all the way through our elementary school until they ultimately come back to us in our new building, which will have a high school in it. And the best part of this whole idea is the teachers will become have already become part of the healthcare team. So our young doctors and our young teachers working together with families, and the part I like the most, we have this ridiculous new building that has 262 apartments in it, and our young teachers and our young doctors all live in the building together, solving these problems at night while Mary and I go to sleep.
Tell me about your international stuff, though. Your parish nurses.
Yeah, so if you know the concept of parish nursing or faith community nursing, so Church Health, we are the home of faith community nursing. We control a curriculum that's used by 148 nursing schools around the world to be trained to do the work of a nurse in a parish or a faith community. There are 18,000 nurses that look to us for how would you actually do this work. Yeah.
Please.
Just a question, does your, you've been talking mostly about medical care, does your healthcare system include mental health care in a more holistic
Yes, right,
sense?
absolutely. So 50% of people who come to a primary care doctor like me have no medical problem. People come to the doctor for reasons they used to come to the priest. It's incredibly complicated why. So a couple of weeks ago, I'm seeing this woman who's 42 years old. She's an undocumented person as well. And so she works as a housekeeper. I mean, we're the doctor for every housekeeper in Memphis, and there are a lot of them. So she's cleaning the house that she works at in a very wealthy suburb. The owner of the house leaves. There are other workers there, and they rape her. Now, she goes to her pastor and tells him the story, and he says to her she needs to, quote unquote, confront her demons. That was very bad advice, meaning that she needed to keep working where all this happened. 6 weeks later, she shows up in our clinic. I'm her doctor with pelvic pain. So I do her pelvic exam, and it's totally normal, because that's not the problem, right? And the problem is this whole experience has crushed her heart. You know, I cannot fix that problem in a 15-minute office visit. So we've actually designed our space. There are 7 exam rooms for 2 doctors. For the most part, 2 doctors don't need that many exam rooms. So what I was able to do is then call in a Spanish-speaking counselor, make a warm handoff, and then have the counselor spend an hour in the room that day. You know, my giving her an extra 15 minutes of my great wisdom, speaking in another language, that wasn't going to make much difference. Now, we didn't solve the problem that day, but what we have done is create a safe environment for her. We've created, you know, we have every means that's available around behavioral health. I mean, there's no quick fix on her problem, right? Yeah, so the answer is yes. And then we are very involved in the issues of substance abuse. So I'm going to make an ad right now. Y'all need to come on Wednesday, the 17th of Convocation, to hear 18th. Is that when Kilzer's playing? All right. You need to come back on the 18th to hear one of the great...
18th of October.
Of October, yep. Sorry. You're going to hear one of the great musicians of all time. Here's his story. His name's John Kilzer. He was an All-American basketball player at the University of Memphis back in the 70s. I'm then willing to argue he's the only Division I basketball player ever to go teach English at his university. While there, he learned to play the guitar from a guy named Teeny Hodges, who wrote the song Take Me to the River. He then goes out and becomes a rock star, for real. Tours with the Moody Blues, has a couple of top 40 songs, has his own MTV videos. That leads him to be an alcoholic and a drug addict. He is subsequently in and out of jail 9 times. The last time he's in jail, he has a religious experience. He gets out of jail, calls his wife Stacy to pick him up from the usual place. It's pretty bad when you got a usual place to get picked up from jail, right? So, but says to her, you won't believe this, but last night in the jail, I found Jesus. She goes, right, John, you can't find your car keys, and you found Jesus. That was over 20 years ago. As only John would view it, the only logical thing to do next was he checked himself into a seminary. Becomes a United Methodist minister. Anyway, he now leads our path around recovery that is tied to music. He came out with an album last year that y'all will hear him sing some of the songs from, I think, that the Birmingham Mail, as in Birmingham, England, declared as the album of the year for the world. Above Adele, above Beyonce, John Kilzer, who you've never heard of. He won't tour because that's what got him in trouble. What he does is recovery ministry. Now, all of that is to say, if I, as the doctor, see somebody with a substance abuse problem, which I see every day, and I tell them, you need to stop drinking, stop drugging, go to AA and get a sponsor, what do you think my success rate for doing that is?
I know what it is, 1%.
1%. 1%. Well, Mary's saying one person because a few years ago, she sends me out to get Chinese. And I'm standing in line getting Chinese, and this guy taps me on the shoulder and says, "Are you Dr. Morris?" I go, "Yeah." He goes, "Well, you saved my life." I said, "Really? How did I do that?" He said, 10 years ago, you told me to stop drinking, and I did. And I go, "Well, ever since then, I bet you I've told 10,000 people to stop drinking, and you're the only guy I know who actually did it." All right, however, it takes me 15 seconds to say you need to stop drinking, stop drugging, get an AA, and get a sponsor. And if 1 out of 100 people will actually stop, I should tell that to everybody. But what I do now is I can say you need to stop drinking, stop drugging, get a sponsor, and go to AA. And on Friday night, really, literally, as we speak right now, John Kilzer holds a service of recovery built around music. And it's at this time, because if you're a drug addict, this is how the time you're thinking, how am I going to get high for the weekend? And then I can say, and I will meet you there and introduce you to John Kilzer. I have dramatically strengthened my hand. And all I got to do is get them there, because there will be 250 other people there who will welcome them and lead them down the path. Now, I have a 100% success rate of people telling me they will come. I have about a 25% success rate of them showing up. But once I get them there, I mean, the door is wide open to make it happen. So.
There's a mic.
The story that you told about the woman who was raped while she was working, and then you said you do a warm handoff to a counselor. Is the expectation for the patients that come to your clinic that would always be done, the counseling would be through a Christian context? Is that sort of part of the mission? I guess I'm thinking that, you know, as a clinician myself, that in these sorts of scenarios, really anything we have to offer from a biomedical model is just a Band-Aid. And so to really address sort of the pain there, you have to go spiritually deep. And so I'm just wondering what the expectation is on the part of patients coming in.
Right. So great question. So what we believe, I believe, Church Health believes, is there is a spiritual dimension of life. That we don't back away from that at any turn. But there is no litmus test. You got to believe the way I believe. So if that person is a Christian and they relate to that at every turn, and that's how they connect to God, we will go through that path as fast as you possibly can imagine. But if that's not who they are, fine. I mean, I don't care. I don't care if you're Jewish, Muslim, Hindu. We're going to go with whatever path you have, because we have the ability to go down whatever faith tradition you have. And if you have none, then you know, we're going to work through the whole AA model of a higher power. On Sunday morning, I want you to be a Methodist. When you come to me in our clinic, we want to recognize that the spiritual dimension of life is, for her, the only way to heal her, because I got no pills.
So you mentioned, you alluded to birth control. Faith communities have a range of opinions about a whole range of health care. How do you deal with that?
Yes, so and let's just go with the abortion issue. Nobody knows what I think about abortion. Do you know what I think about abortion? Yeah, and I have never spoken about this to anybody. So you may assume what you think I know about abortion, but you are making an assumption that may not be right. The reason is, on this issue, I cannot win. There is no way so fine, we don't do it. You can criticize me for not dealing with it, but you cannot criticize me on what my position is because you don't know it. Now, on the birth control issue, once LARCs came out, long-term reversible contraception, some of you all, the healthcare people probably know what I'm talking about, that changed a huge dynamic for me. So our patients, a poor teenager especially, if she gets pregnant, I mean, the statistics bear me out, there's more than a 90% chance that you are condemning the mother and the child to a life of poverty. I can't go there. I can't go there. So, I mean, I have had to, on certain levels, my Catholic friends forever have stepped away from us because we are doing this.
Is that right?
Yes.
Okay.
And I mean, a doctor who had been with me for 25 years when we started doing LARCs. And even, she didn't have to do it, but the fact that our clinic was doing it, I mean, she couldn't do it. And I said, Mary Nell, I love you, but we're doing this. I mean, I don't know.
How do you approach
I'm sure all of y'all won't agree with that.
How do you approach the making of those decisions?
Great question. So, I mean, hopefully I'm not a dictator. I mean, it's not just about Scott. I mean, this is something I think as a general feeling. I mean, we have 300 employees. You know, I mean, I lost a doctor and a nurse. I had a nun who left with my doctor over this issue who are Catholic. And I still have other Catholics who work with us. We talk openly about it within our staff. You know, we don't hide it. I'm not saying it's easy, but I mean, at the end of the day, it's going to fall to me. You know, this is an example of the buck stops with me on these issues. So. Yeah.
So what other types of pushback do you get being a faith-based clinic aside from the birth control issue? And also, what is a more detailed version of your financial structure that allows you to be sustainable and to keep doing the work that you're doing?
Yeah, so, I mean, we've been around for 30 years in Memphis. At this point, we really don't get pushback. You know, my biggest congregation, I could argue, that supports us is Temple Israel. And, you know, our Jewish support is incredibly strong. Starting next Friday, the Muslim doctors in Memphis will be praying in our chapel on Friday at 1 o'clock. So the challenge is, I mean, we are the buckle of the Bible Belt. You know, Bellevue Baptist Church, which has the current president of the Southern Baptist Convention there, they struggle to support everything I've been saying. However, to your point about the financial thing, some of our biggest donors are their biggest donors. And it is amazing how the preacher tolerates me for that reason. So how do we do financially? So we're not a free clinic. I don't believe in free clinics. Poor people aren't looking for a handout. They're looking for something they can afford. So we charge on a sliding scale. Most people pay between $20 and $35 for a visit. And that's no matter what the problem is. You got a cold, you got a broken bone, you're at death's doorstep. You know, it's obviously a better deal the sicker you are, but for $35 is a pretty good deal no matter what. But it means we have to raise about $20 million a year to keep our doors open. So that's real money that we're out there knocking on doors. I consider myself to be a professional beggar. Jim and I are in the same profession there. And our view of this is that 90% of the money we raise must come from individuals. In order to sustain the work we do, it has to come from individuals. You know, you can't rely on foundation grants. You can't rely on corporations. They're both incredibly fickle. And over time, though, individuals will support you year after year after year as long as you are transparent, you do what you say you're going to do, you thank them again, you thank them one more time. And we've been able to do it.
What is your operating budget?
Like 25 million. So we earn about 5 and then raise 20s.
Kate.
Hi, Kate. So you have a family, you're asking for money, you're seeing patients, you're also starting educational things and will meet people at narcotics meetings. What does your average day look like? Are you seeing patients still, or are you gotten to the point that this has gotten so big that you are trying to just, you know, kind of keep it all floating at the top? What are you doing?
So I bring my wife with me. You know, if you want me, Mary's coming with me, that's one thing. But I don't leave Memphis very often. I mean, truly, I don't. So, I mean, about half my time I play doctor. The other half the time I raise money, and the other half the time I do whatever else is left. So.
Actually, you mentioned that 4 mornings out of the week, Scott does walking clinic. So he sees the people who are coming in, usually for the first time, and with a compendium of he can set a bone faster than anybody, but he also sees a lot of these other problems. And then I'll just answer this for you. He as much as he takes care of medically the patients that we have, he also takes care medically of many of our very wealthy donors. They're always calling us at all hours of the day and night, and he really gets insulted when he's found out they've not called him when something's wrong, because spiritually he ends up taking care of our wealthy donors as much as he does our patients, because those people who have a whole lot of money are often very lonely and spiritually bankrupt, and that's where he can walk in and do that. I'll say I answered it better than you did.
Nobody should be surprised about that. So.
James.
Hello. My question is very simple. How has the church at the local conference and general level been a support to your cause from the inception up until now?
Yeah, so it's been a 30-year challenge for me, to be honest. You know, for all these reasons, this Descartes thing is real. Churches still struggle just to keep their doors open. So, I mean, we have never looked to the individual church and certainly not to the denomination to make any significant financial gift. However, we are always looking to be in a church's budget, because being in a church's budget is a good housekeeping seal of approval. So when I'm looking for those individuals who are going to make the gift to us, if we're in their budget, that's a really, really strong thing. And then we're looking for churches to embrace this idea of health ministry. And I mean, we have an entire team of what we do is go to a church to help them create that health ministry. You know, a lot of wealthy churches go, oh, we don't need that. Well, actually, they may be the ones that need it the most. We have probably been far more successful working with small African-American churches to create health ministries than we have our suburban churches, and fine, we let them help us with the fundraising arm, but we never give up on that. At the denominational level, that's frustrating. I mean, I've been the doctor for half the bishops in the United Methodist Church, maybe your bishop. And that's actually been a fascinating thing, mostly to watch how sad so many of them are. As being the doctor of one bishop, I mean, he doesn't mind me telling this story, that his daughter had said to him, Dad, before you became a bishop, I don't ever remember seeing you cry. After you became a bishop, I can't count the number of times I've seen you cry. I mean, that's sort of a reflection of the state of affairs that is not healthy in at least the United Methodist Church, but I think we're all pretty much the same there. So,
what happens in a church when they support you for a while? I mean, whether they're getting health care from you or not, do you see a different conversation begin to take place in the midst of congregations?
Yeah, they start talking about our health clinic.
Well,
they start using the we language.
Yeah.
And,
so, but is that external to them, or is it also about their own well-being?
I really think it's both. I mean, I think so we moved in this ginormous new building now, which we don't have time to talk about, but it has been a magnet for drawing volunteers. We've always had volunteers, but now people just love to come down and look at what we have done. And I mean, Mary sees it all the time as well. So yeah, so that we language is the most powerful thing. But I mean, look, the work is still fresh out there for trying to engage churches on these issues, because you know, we still have a hard time understanding how health is part of what God has called us to do.
Mariah.
My question is for people who are in, you said that you're mostly successful in African American churches. So for people who are in like a young, mostly white church of millennials, how would you sell a healing ministry when typically millennials they're young people, so they don't have a lot of I think, visible health issues. So how would you sell a church on having a healing ministry?
Yeah, so our experience with the millennials is they want to do good. They want to make a difference. They want to figure out how they can be engaged with something. And so we go work with them over what that might be. And somebody a lot smarter than me said you should always overinvest in the young. And we have done that in a really big way. So we have a gap year program. We hire vistas. We run a residency. And you know, I let them be the ones that engage millennials. You know, in my head, I'm still their age. Mary has convinced me I'm not. So, yeah, I'm not going to say millennials are not challenging, but yeah, we're not looking for millennials to write checks, but millennials can do a monthly gift, even if it's $5 or $10 a month. And so we are asking for everybody to do their fair share. So we don't back away asking for their money.
Does your staff of docs, of PAs, of nurses, of other health workers, and of business folks, would they all know that you're a pastor?
Oh, yeah. In fact, we just went through a succession planning thing. So people have been wondering about my succession plan since I was 40 years of age. It didn't make any sense now. I'm now 63. It actually does make sense. But, I mean, our staff, in looking through this, universally agree. The number one role that I play is not doctor, but pastor. And so whoever takes my place is going to need to be a graduate of Yale Divinity School. No, they're going to at least have an M.Div.
I'm looking at a few of you.
Come talk to me, y'all. Yeah.
I hope that you'll take some time and take a look at some of those books, which are compelling. They tell compelling stories. The magazine is here, and I think we're giving those away, aren't we?
Oh, good. Great.
We're giving the Church Health magazine away. Did you have another thing?
Well, I want to speak about one of these books, which is another just YDS deal. So when Jim and I were here at YDS in the 70s, Henry Nouwen was here. It was a great experience for me. I actually consider myself to be a Henry Nouwen failure. So Henry, at one point at Christmas, told me that I needed to go to Taizé. This is before anybody ever heard of Taizé, and spend a week in silence. So if Henry Nouwen tells you to do that, what do? You go. So I went, and I was absolutely miserable. It was cold. Nobody spoke English, and you couldn't talk. So my only friend that entire time was a cow I met out on the farm. Anyway, move forward. You know, Henry died in 1992. And since that time, he has not written one word. We have now partnered with the Nouwen Society, though, which is just ironic in some levels, because one of the things that Henry wrote a lot about, and there's still unpublished work out there, is over the issue of caregiving. And for some of y'all, baby boomers, this caregiving thing's becoming really important. Well, our partnership with the Nouwen Society is over. Henry is incredibly inspiring around the word of caregiving, but what he's terrible about doing is giving practical applications. What do you do? That's what we do. So like this book over here on caregiving, this is the first to come out. It's a 6-week daily devotional with unpublished writings of Henry Nouwen that will inspire you around caregiving, and then it leads to, and how do I really do that? So there's going to be a conference here in November, right? And the Nouwen Society will be here. We have another book coming out in another couple of months. But this issue of caregiving, the church ought to be all over. And having Henry Nouwen lead us in that, what better deal could we have? And people at Yale, I would think, would care about that.
Thank you. Join me in thanking Dr. Scott Morris.
Great. Thank you.